The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello to all you TMD warriors. I am Tony Urbanek, and we are here for the next episode of TMD Demystified. Today's episode, I had given a tremendous amount of thought into actually doing this episode, whether either I should start this episode or not. Bear with me, but this particular topic is going to go very deep and very wide, and I've debated with myself whether or not I should tackle it, and I cannot not tackle it. The misdiagnosis of TMD and the misdirection of patients with this series of severe symptoms is so pandemic that it needs to be classified as a medical scandal. I don't say that in a hyperbolic way. It's not hyperbole. I wish it was. I truly wish it was. That's why I've debated with myself whether I should go here. And I get no satisfaction out of poking the bear, because you know what happens when you poke the bear. But there's a bear living in our backyard, and you can't keep the bear there. You have to get rid of the bear, or he sooner or later is going to come and bite you and do worse. So this is a scandal, and I encourage anyone who wants to debate this or make positive or negative comments about this to do so, because it needs to be opened for a national inspection. I have been working on this issue of TMD now almost all my career, as you should know or well know, people that watch this podcast routinely, and I know there are many. Or if this is your first time, this is going to be a very surprising episode for you to start with. But this actual scandal, when you have a huge problem that affects 45% of females and a much lesser percent of males, but sometimes more significantly, and it's not diagnosed routinely correctly at all, that's truly a scandal. It can't go on. I treated temporomandibular joint issues routinely, and a lot of it surgically, for 30 years, and 11 years ago I gave up on surgery and decided to see if I could figure it out, why no one else could figure this problem out. And there was such a dearth of actual proof and actual reproducible findings that doctors and patients could count on. And what happened is I found there may be other significant treatments, solutions to this problem. I don't say that disoccluding the posterior teeth, unloading the joint with a device over a period of time, according to a protocol, is the only solution that will ever be found. But right now, we know it really works. But what I also found out is I fell into a really deep black hole, a rabbit hole that took me well beyond what I expected. First, I discovered how huge this problem was, I had no idea. Now, lots of studies say it's 25%, 35% of the population, especially the female population. Actually, it's much more. It's at least 45% of females. We've touched on that many times. So it's a huge, huge problem. And when patients with these symptoms, which are, we'll enumerate probably a little bit here, but when they go to a doctor, a walk-in clinic, or anybody else, or Dr. Google, they get diagnosed with migraine headaches, earaches, sinus problems, Meniere's disease, when it all is all established and coming from inflammation within the temporomandibular joint. In many different ways for the past few years, I've been trying to bring this out to the medical establishment, my colleagues in the American Association of Oral Maxillofacial Surgery, who have denied me access to speaking to my colleagues at the annual convention. 3 attempts, honest attempts to present this material to the American Association of Oral Maxillofacial Surgeons. It was denied 3 times. I know what's going on. I don't take it personally. This is not sour grapes. It just is what is. I did a 7-minute presentation which outlined the whole concept of inflammation within the temporomandibular joint, how it works, and why inflammation can directly cause all those symptoms, and my experience with it, the American Academy of Science and Engineering and Medicine 2 or 3 years ago. That went nowhere. It wasn't even mentioned or the concept even mentioned, not me, I don't need to mention, or the concept even mentioned in the book that was derived from that Academy meeting. In fact, inflammation within the temporomandibular joint causing all the symptoms was not even mentioned at all in any part of that document that derived from that meeting. That's bad enough. I've known this and commented on it and brought this out on several other episodes, but the thing that really tripped this is I scan the literature and I scan the internet routinely. I don't have a whole lot of time to do it, but routinely about TMD, TMJ, the different confusing diagnoses, the confusing diagnosis of Meniere's disease, migraine headache, sinus pain, whatever, that are always confused with TMD, and ran across an article from a public site that enumerated all the different types and occurrences of migraine headache, where migraine headache, the types of migraine headaches, and where migraines come from, and the potential or the potential causes of migraine headaches, because no one has the answer. They all admit that the researchers, the scientists admit that they don't know really what causes migraine headaches. And TMD was not even mentioned in the list of 20 items, not even mentioned, or inflammation in the joint, not even mentioned. And, you know, that was a public site, but I can tell you my medical colleagues, and I deal with them every day here in Middle Tennessee, until we began to educate them significantly and highly, they, had no idea that, migraines, quote, migraines, and in quotes, that's in quote intentionally, can be derived from jaw joint problems, whatever you want to call it, TMJ, jaw joint problems, TMD, more specifically, inflammation within the temporomandibular joint. That's it. It's not the disc. It's not where the disc is located. It's not, how far you can open your mouth, but all those symptoms of headache, earache, jaw pain, neck pain, upper back pain, tinnitus, subjective hearing loss, and feeling of fullness in your ear, vertigo, shoulder pain, upper shoulder pain, arm pain, arm, hand, finger tingling and numbness, and locking of the temporomandibular joint are the well-known, well-established, well-agreed upon symptoms of TMD. And what's TMD? TMD is inflammation within the joint. Chronic inflammation in the joint causes all those symptoms, and chronic inflammation of the temporomandibular joint is the definition of TMD, along with the symptoms. It's a scandal, and this episode is going to be the first part one of what I'm sure is going to be a multi-part attempt on my part to outline and to make available to both the medical community and the public community as to the scandalous part of this, because it is ridiculous. If we had misdiagnosis of heart disease half the time, if you go into a doctor with actually various kinds of heart disease, and half the time it was diagnosed as a renal failure or a renal problem, or if you went in to a medical doctor with symptoms and you actually had diabetes, and half the time it was diagnosed as a stroke, that would be a scandal. That would be a medical scandal. We know, we see, I have seen routinely here in Middle Tennessee over the period of the last 11 years since I've been delving into this non-surgically, routinely 50% of the people, at least, who go in to their PCP, walk-in clinic, ENT, neurologist with multiple symptoms, which are well-known, well-established symptoms of TMJ problems, and they've been misdiagnosed as to anything and everything else under the sun other than inflammation within the temporomandibular joint, and treated such with drugs, some of them with surgery, a few of them with neurosurgery, orthopedic surgery. Many people now have been exposed to and addicted to opioids that were totally inappropriate and unnecessary. And the list goes on, and that's what I am going to try to cover in these episodes. This is not a pleasant. Some of my episodes in this podcast I really enjoyed doing, and I've really liked sharing my information and sharing my knowledge and encouraging others to get involved and help me solve this problem. But this one I am not enjoying at all, because number one, I am poking the bear. The establishment of any kind, and I'm not picking on medicine, I'm not picking on dentistry, establishment of any kind naturally, rapidly gets to the point of supporting itself and protecting itself. And so when anyone comes out as a threat or to make that establishment wrong, this can be political establishment. I won't go any further comments there. I think we are seeing a lot of that right now, or economic establishments, business establishments, religious establishments. Any establishment has a natural mechanism to protect itself, which may not, in fact, usually is not rational, works out not to be rational. And so I try to be rational. I consider myself a very rational and logical person, and try to attack things from a rational, thought-based, logic manner. And so we're going to do that. It may be boring to you. I'm sorry if I am, but I am doing this, number one, to make an attempt to make my medical colleagues aware and the public aware, but also to document it. Once things on the internet, it used to be you had to write a book or get published in a newspaper. Nowadays, if you put something on video, it's established forever. And that is what I want to do. I want to document this, because the fact that it can be documented, the fact that I am documented, hopefully will put a little fire on someone or group or people to jump on board and help me investigate this. I'm not a investigator. I'm not a journalist. That's way outside my wheelhouse, but apparently I have to take on some kind of hat, some kind of interest along those lines, as a journalist, investigative journalist would be. It's not hard to investigate this. The information's all over with. This is not a difficult problem for me, because I walk all the rails. I walk and have walked the rails in the medical industry as a medical doctor. I've walked the rails as a dentist in the dental industry, and I walked the rails in the academic and research rails as a researcher with my own research project funded by the NIH while I was at Vanderbilt, and with my academic degrees in cell biology and anatomy. I was supposed to be, according to me, I was trying to get all this knowledge and experience to go into academics. But at the end, I went into private practice. And that's the whole other story, why I did that. I don't want to get off point. It is a scandal that a huge number, we don't know how many, but I would say more than half of the people that go into a medical practitioner with obvious symptoms of TMD are almost automatically misdiagnosed, misdirected, and mistreated in some other way, at least initially. And for many, many, many people, for 10 years, 20 years, 30 years, 40 years, and I have a few patients, a few elderly women who have suffered from all or some or all of those symptoms their entire life and been misdiagnosed by medical practitioners for 50 years. I can document that. That is a scandal. That's the right word to use. It's not hyperbole. I don't know how far this is going to take me. I don't know how many episodes, parts to this episode I'm going to do. So, and I don't want to make them long. So I've breached the point to open it up. That's all I've done so far. So let's just kind of consider, my experience briefly, very briefly. So far in the past 11 years, especially over the past 7 years, I've treated personally successfully here in my practice now, with my help of my associate, Dr. Urbina, 4,000 people using our device. I hate, urbanic device. Okay, that's what I had to name it. Couldn't think of anything better. But a device separates the posterior teeth according to a protocol 24/7 for 2 months, and then nighttime after that. We've successfully treated over 4,000 people and gotten rid of, diminished one or more of those symptoms that they come in with that I just mentioned earlier on a routine basis. My oral maxillofacial surgery colleagues call that anecdotal. And I won't tell you the whole story, but I have been told that it's meaningless. Okay, so now I funded independently, I've commissioned and independently funded an independent study through Middle Tennessee State University that had access to those 4,000 patients and randomly selected, I think it was around 400 people out of that 4,000, and did an independent study, analytical study, and proved the success rate that we claim and prove how satisfied patients are and proved how each and every one of those symptoms diminishes by doing what I just said, decreasing the forces on the temporomandibular joint, which decrease the inflammation, which decreases symptoms. It's that simple. But having that available to patients who routinely come in here and after treatment say, how come nobody ever said anything about this? I wish I would have known this 20 years ago. We hear that routinely. My associate hears that routinely. He heard it last week. I've had this problem for 20 years. How come nobody ever said anything? How come I was on headache drugs for 20 years? How come, I've had surgery on my neck when all the time that the problem was that my neck was tight because I had TMD. That's not anecdotal. We'll probably talk about the definition of anecdotal. Let's just pick on one for the sake of discussion to make my point across before I end this for today. Let's talk about the migraine, because that is the most common misdiagnosis. I have studied migraines up and down over the past few years, trying to get my arms around what's known about migraines, what isn't known about migraines. What I found out about migraines is the medical community is totally confused about migraines. First thing that they say is, we do not know what causes migraines. That is true. That is accepted. But according to Dorland's Medical Dictionary, excuse me for doing this, but I had to do it, so you get to do it. A migraine, according to Dorland's Medical Dictionary, is as follows. From the French, from the Greek, hemicranial, half the cranium, an affliction of half of the head, an often familial symptom complex of periodic attacks of vascular headache, usually temporal and unilateral in onset, commonly associated with irritability, nausea, vomiting, constipation or diarrhea, and often photophobia. Attacks are preceded by constriction of the cranial arteries, usually with resultant prodromal, sensory, especially ocular, symptoms, and commence with the vasodilation that follows. I'm going to finish just reading it. Dorland's Dictionary, Medical Dictionary. Abdominal migraine, migraine in which the abdominal symptoms, nausea and vomiting, are prominent. Fulgurating migraine, violent migraine developing abruptly. Ophthalmic migraine accompanied by amblyopia or decreased vision, decreased light, or other visual disturbances. And ophthalmic migraine, periodic migraine accompanied by ophthalmoplegia. That's what Dorland says a migraine is. And that's where I don't dispute there isn't such thing as a migraine headache. But what I see and what everyone who treats these patients has seen, that there are a huge number of patients, huge numbers of patients who have been given the diagnosis. Migraine is a catch-all now. Migraine is a word that is now defined in the public and the medical community as any bad headache. Any bad headache is now called a migraine. So a couple nights ago when I was on the internet cruising around and I saw a list of 20 different kinds of migraine, 20 different types or descriptions of migraine, and not one of them, of those 20, included a TMJ migraine. So this is what our public is exposed to and our medical colleagues, because unfortunately nowadays, even the young medical colleagues on rounds get all their information out of here. And my friends who are professors confirm that. I don't know what's going on out there. I certainly wouldn't agree, but that's what they see from the residents. That's how the residents get their information. So we have a problem. I'm a problem solver. In my surgical career, I was well known as a problem solver. When some of my other surgical colleagues had a problem that they couldn't solve, more frequently than not, it ended up in my practice. And I enjoyed taking a potential surgical problem and figuring out a way. And that was how I did my surgical career. So I'm a problem solver. I have figured out what's really going on with TMD. And unfortunately, it doesn't follow the curriculum and the established thought process about this problem. And frankly, there really is no established thought process about TMD because it goes all over the place. And there's a lot to say about this. That's why I know this is going to be a multi-part episode or multiple episodes that have separate parts and will attack this issue in separate ways because I can't possibly really focus on it. What I wanted to get across today is I'm poking the bear. I am poking the bear because this is a scandal. And what we've established here is not anecdotal. We now have a verified analytical, statistical study that proves it. I'm not trying to make myself right. What I'm trying to do is get others to actually look at this problem. I cannot get my oral maxillofacial surgery colleagues to look at this. I cannot get the medical establishment that presented itself at the American Academy of Science, Engineering, and Medicine in Washington, D.C. to look at this. Just look at it. Just look for yourself and investigate it yourself, and you will see what I have seen. That's what I'm saying. So there'll be more that I say. I'm going to pick this apart. I'm going to pick this apart in many different ways. And I hope I don't bore you. I hope there are a few out there that find what I have to say is interesting, is more than interesting. I got into medicine. I got into dentistry. I got into medicine because number one, I wanted to help people. Number two, I wanted to challenge myself into something that I thought would keep me interested my entire life, which it has. I have been very, very interested and had a tremendous career in maxillofacial surgery and doing major facial reconstruction throughout my life. Absolutely enjoyed the whole thing. And now I'm enjoying this part of my career. I just happened to stumble into the successful solution, non-surgical, for TMD. I'm trying to attempt to get as many other practitioners on board who can treat these patients, because certainly I cannot do this all from Middle Tennessee, although people now are filtering in from all over the country. I think I mentioned on the last episode, I had a woman and her husband come in from Dallas, Texas, who had spent months in Dallas, Texas with 14 separate practitioners, and somehow stumbled on to me. I'm not sure how they stumbled on. She didn't say that, but she did say that she had binge watched my episodes on Dental Town. And it all made sense to her. And that is why she came to see me. It made sense to her, what I was saying, what I was teaching, what I'm trying to get out there for others to look at. You do not have to believe me. I'm just asking you to look at it for yourself and to see whether or not it's successful, whether or not it works, whether or not it makes sense, whether or not you can use it to help other people. So I'm poking the bear. I absolutely don't think there is a conspiracy out there. It's not a conspiracy of ignorance. It's just ignorance. Ignorance can be found in many ways, but seeing seeing a problem and not looking is one form of ignorance. And responsibility, I feel responsible now that I know this, now that I see it on a daily basis, now that we see here in our practice, people daily, not weekly, daily, we have a huge practice, the daily come in here and say, how come nobody ever told me about this? You know, I cannot deny that I've seen it, and I have to take responsibility to do it. If I see a child, not my child, somebody else's child, running out into the middle of the street, do I have a responsibility to grab that child and bring it to the curb? Absolutely. I have a responsibility to do that. You couldn't be human if you didn't take that responsibility. It wouldn't be appropriate. It wouldn't be ethical not to take responsibility for things that you see that are going badly, that hurt people, and not try to help. So that's where I am on this thing. I need others to take a look. I don't want you to believe me. Just, you can read our study. That'd be nice. You can do one of the devices yourself and see for yourself how well it works. And we got a bunch of doctors out there who are doing that. And I'm happy to say that they've joined the network. I think I've gone on long enough, probably around 30 minutes now, more than I wanted to. So if you want to learn more about how to treat TMJ effectively, TMJ problems effectively, TMD, jaw joint problems effectively, you can contact us. You can contact me at tmjservices.net, or our Director of Marketing and Education at Naomi@tmjservices.net. I invite anyone who is interested in solving this problem with me to look on our website for doctors who want to join our group, our network at www.tmjservices.net. Anyone is welcome. We're very transparent. Come on to Nashville, spend time on Broadway and have a few beers down there and march up and down with the music folks, and come out to Brentwood, and I'll be happy to entertain you and take you to lunch. And you can see what we do here in Nashville and in Brentwood, Tennessee, treating thousands of patients who are sent to me now from over 700 doctors in Middle Tennessee. I encourage your comments. I encourage your criticisms. There's a way to do that on this Dental Town podcast site, or you can email me with your comments and criticisms. Happy to take them. For today, I would just like to finish it up saying I encourage all of you to work hard in your practice. I'd like to help you solve the problem with TMD. Until next time, I am Tony Urbanik, and this is TMD Demystified.